Do you want me looking here or at you?
Oh, you look like the phone. You can do whatever.
Okay.
What's up, everybody? Welcome to the Dropping Wisdom with Santos podcast. And today, I'm once again mobile. So if you would like for me to come to your office or your home, please reach out to me and see if we can make that happen. That being said, please introduce yourself and tell us what it's going to be about today.
Okay, my name is Dr. Erin Callahan. I am a prenatal, pediatric, and family chiropractor. Today we're just going to be talking about chiropractic because one of the questions I get asked frequently is, really, babies getting adjusted? And yes, in fact, every single day.
Okay, I'm going to ask a lot of questions.
Sure.
101 questions because I'm asking them because I don't know anything. Dr. Erin Callahan, DC.
Yes.
What does DC stand for?
Doctor of Chiropractic.
Okay. Instagram, Hope Chiro VB. To email, info@hopechirovb.com. Website is hopechirovb.com. And to call 757-354-1577 is the
Right.
work call. And you have a patriotic address,
I
1776
sure do.
Laskin Road, Suite 203.
Mhm.
Okay. First question. What's your qualifications, education, certifications, and why did you
Sure.
get into this field?
Oh, wow. Okay, so this is a loaded question. I'll start with the easy stuff with the qualifications. My undergraduate is from LSU, go Tigers. I have a BS in kinesiology. From there, I went to chiropractic school. It's another 3.5 to 4 years for the doctorate program. Because I specialize in prenatal and pediatric chiropractic, I also am with the ICPA, which stands for International Chiropractic Pediatric Association. So lots of extra classes, continuing education that I do every year as often as I possibly can. There are higher certifications that you can get, but working with pregnant women and babies, you absolutely should have more education. Before graduating chiropractic school, I also was with Epic Pediatrics and lots of functional neurology, lots of interests here and there just to kind of get me to where I am. As far as what got me into chiropractic, the origin story of Hope Chiropractic starts with my son. So my son is almost 17. He'll be 17 in a couple weeks. But he was vaccine injured as a child and he regressed very severely into autism. We were working with an MD in Baton Rouge, and then my best friend at the time, she was in chiropractic school and suggesting that I go to any chiropractor and just work with him. So you can imagine, just like anybody, I was curious about why I would do that because my son didn't have neck or back pain. And you know, funny enough, I still get those questions to this day. But what's really awesome is that we threw the book at everything for my son. I knew that wasn't his story. And we started getting him adjusted, and very quickly his nervous system was healing. And then it started being able to do the things that it was normally supposed to do and function. So he healed, he started talking, he started pooping, he started being able to be held, touched, use crayons, for instance, wash his hands, and all of those things before were virtually impossible because it was painful for him or it wasn't happening, etc. So as you can imagine, I was on my way to go to med school and I wanted to work in neurology and I was very interested in it and very good at that. So of course, at that point at LSU, I was like, well, I'm pretty sure that this is a pretty big sign from God to tell me you need to go to chiropractic school because more people need to understand what the power of their body is able to do. Yeah.
I wasn't aware about that. That's crazy.
Yeah.
What do you need to know about your client or patient? What do you call them? Clients or patients?
They're patients.
Okay. What do you need to know about them? Like, let's say if I walk in and I just say I need an adjustment, you're gonna ask why? What do you think you need that for? I'm like, I don't know. I'm just lift weights a lot. I like to go to the gym, and I feel like it's probably needed. Well, what do you need from your patients?
So first and foremost, you don't need to have a problem to start chiropractic care. In fact, wellness is really the end game of everything. I get my kids adjusted at least once a week. I get myself adjusted at least once a week, sometimes more. But the information I need to know from my patients, we always like to know what your chief complaint is anyway. Meaning, are you coming in for neck pain, back pain? Cool. I mean, I definitely want to take care of you. I want to know what your history is. I want to know what your baby's history is. How was the birth? How was preconception? How was pregnancy? Tell me about all of the stressors, toxins, traumas, thoughts, relative to all of those stages in your life, your baby's life, etc. I mean, the sky's the limit. Whatever your goals are, we ask people what their goals are regardless of what they are physically, because in the end, your nervous system controls everything. So if you come in to me and you say, I'm not sleeping well, okay, well, we're going to talk about when it started, why did it start, what are the other components that could be contributing to that, and we're going to talk about how your nervous system controls A, B, C, D, E, F, G. But we're also going to do the CLA insight scans that tells us on a deeper level what's going on with your nervous system, as opposed to just being like, well, your neck hurts because you hit it. It's so much deeper than that. That's the tip of the iceberg.
Okay, so when someone comes in here and you tell them that, like, how do you... I just have so many questions because I'm just really...
Yeah.
Is there ever an end game and you say, hey, you're cured?
Oh, I don't cure anything.
Oh, you don't? So
No.
So what does that mean?
So your body, all it needs is full communication between brain and body. Your body wants to heal. That's called innate intelligence. So we're all born with innate intelligence, and it's basically, are we bringing ourselves closer or farther away from that healing? So on a daily basis, if I wake up and I didn't sleep hardly at all because I was doom scrolling, I'm eating fast food every single day, or not eating, drinking a ton of coffee and just elevating my cortisol before I even had a chance, not moving my body, I'm sitting down all day long. I am moving my body very, very far away from wellness. But if instead I am getting adjusted, I am prioritizing sleep, I am prioritizing nourishing my body. I'm not talking about a diet, I'm talking about nourishment. I'm also very, very into my spiritual health. I do a daily devotional.
Okay, now about the sounds of freedom.
It's about the whole body wellness, right? So it's not that we have an end goal per se. I think sometimes people come in and they're like, well, I'm no longer in back pain. I'm no longer in this chronic pain that's been plaguing me for forever and ever. And now we have new goals, right? So every time that we have a progress exam in our office, we're also asking you, okay, you started off and you told me that your baby wasn't pooping, was screaming constantly, you're having a hard time breastfeeding, etc. We get into however many visits we are, and we're going to just readdress, where are we now? Okay, so your baby's pooping every day, excellent. Now you're breastfeeding with ease, excellent. Okay, so where do we go from here? Let's talk about wellness. Let's talk about weekly or bi-weekly adjusting schedules. Let's talk about where we want to go to next. Sometimes that will evolve, especially with adults, that'll evolve. Well, now I want to be able to bench press with blah, 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 blah. Cool, let's go with that goal. But ultimately, if you think about chiropractic as more exercising your nervous system, that regulation, that ability to create more goals and meet them, that's really the end goal. It's not, I'm going to adjust you 5 times a week for 6 months and now you'll never feel back pain again. That's not even remotely possible. That is absurd. Another facet of that is that pain is the last thing to show up and also the first thing to go away. So if we only look at pain or look at treating people and adjusting schedules based upon pain, we're missing a lot, a ton. Because if you also look at the types of nerves that our peripheral nervous system is dealing with, right? So central nervous system, brain and spinal cord, everything else is peripheral. So we have our somatic nerves and then we have our autonomic nerves. Somatic nerves tells us how we feel, tells us pain, tells us like where our muscles are, where we are in space, that kind of thing. So we've got motor nerves and we've got sensory nerves and somatic nerves. Everything else is our autonomic nerves. That's tissues, organs, glands, etc. That's function. That is the vast majority of our peripheral nervous system. So if we're only focusing on pain, we've got this little teeny tiny aspect of our entire central nervous system, and we're missing the big stuff. We're missing function, we're missing sleeping, eating, pooping, we're missing connection between not just ourselves, but our environments.
Why do you keep mentioning pooping?
Oh, we talk about poop a lot.
Yeah, I noticed
in our
that.
office.
Yeah, why
Yeah.
is that?
Well, if you think about, so in our peripheral nervous system, okay, the autonomic nervous system is split up between two others. So we've got the sympathetic, which is our fight or flight protection mode. We like to talk about like the bear chasing us. The parasympathetic is rest, digest, growth, development, and healing. So if you think about pooping, if you have somebody, a lot of women especially, they think that pooping once every 3 or 4 days is normal. Absolutely not.
How could you ever think that's normal?
Yeah, exactly.
But are period poos normal?
Period poops?
Is that normal?
Okay, so
So I'm not trying to be funny.
remember,
I'm being serious
there's a
though.
difference between common and normal,
Okay.
right?
Okay.
So is it common? Is it common to have pain? Yes. Is it normal? No.
Okay.
Right? So the same thing with like there's so much more to go into like menstrual cramping and menstrual poops and all things like that. Yeah, they can go together, but it also has to do with hormones and what turns them on, what turns them off.
Okay.
Yeah, that's it. You just dug a bigger one right
Yeah.
there. So that's a whole other topic.
That's a whole different
Yes.
topic
So that's
of
why I
pooping.
talk about poop. So pooping is important because it tells us like, okay, well, I'm taking
Especially when it comes to babies, right? Is that
Heck
more important
yeah.
with the babies? Okay.
Well, it's important for everybody.
Okay.
You would be very surprised how many adults would come into my office and say that they thought that it was normal to poop every 3 days or once a week.
I'm proud to say I poop maybe at least twice a day.
Good.
I'm proud to
That's
say
good.
that.
That's what we want. Yeah.
So
We have a lot
I'll
of
have a lot of haters out there. I'm just trying to let you know. I have a lot of haters.
yeah. I mean, but considering that, if you poop once or twice a day, and then you have a baby and they poop once a week,
That's not good.
no, it's not good. And we have so many different
The baby
providers.
poops once a week or the mother poops once a week?
Anybody. If anybody is pooping once a week,
That's terrible.
terrible.
Why is it?
Don't
You have bad diet, what else is going on?
So we look at it from the perspective of the parasympathetic nervous system,
Okay.
right? So your vagus nerve is a big daddy cranial nerve that comes out and basically exits the spine around C1, C2. It tells all 3 levels of the gut what to do. It quite literally tells all the things what to do, when to do, and how to do it. But if, for instance, we're having an issue with a baby that's not pooping, you would also potentially seeing reflux or colic or ABCDFG, right? That's because our nervous system builds on systems. It builds on scaffolding. So if a baby is not pooping, that tells us a lot, because that means that their nervous system is not functioning in a parasympathetic dominant state. What are babies supposed to do? Eat, sleep, poop. A lot of people say cry because that's their way of communicating. But eat, sleep, poop, and grow. That is it. So if they're having a problem with any of those things, that's kind of a big deal. That means we have weak scaffolding.
Okay. And you do prenatal, pediatric, family chiropractic.
Correct.
How do you determine a treatment plan?
The scans, goals, the chronicity. There's a lots of methods to my madness.
Okay. What is a chiropractic adjustment?
Oh, okay. So this is another can of worms. Not necessarily worms, but a chiropractic adjustment is where we are looking for subluxation. That's our fancy word that we use to describe 3 components. A bone that's out of place, not moving, and subsequently not communicating properly between brain and body. We can get super nerdy into that with regard to neurology, what we're looking at proprioceptive wise, restoration of that proprioception. But I'm just gonna kind of stay right there because we could go super deep into that.
Okay.
So the adjustment is by any means. It can be a manual adjustment. It can be a tonal adjustment. It can be.
What does that mean?
So a manual adjustment is where I quite literally use my hands.
Okay.
A tonal adjustment can be anywhere. There's so many different techniques, but we're using either fascia, we're using instrument, we're using even just like, for lack of better terms, energy resources. It would be hard to explain that.
Energy resources.
So it would be hard to explain that without like showing you.
Okay.
But in general, we have some practitioners that I don't do that. So there's a practitioner that can use what's called network, BGI. There's so many different techniques. But in a nutshell, the adjustment removes subluxation and restores communication between brain and body.
How do you measure a treatment's success?
We look at the chief complaints. We look at the scans. So if we look at somebody's scan, and just for lack of like time, I guess, if we only look at the neurothermal scan. So I'm going to bring back like the idea of the bear, right? So if a bear is chasing me, it's not important for me to stop and take a poop, right? I'm not going to be like, yeah, let's drop a deuce right now. No, I'm not going to try to, make a baby or have a baby. I'm not going to try to, have a picnic with my kids, right? I need to get out of there. But another important factor, especially when we're looking at the CLA Insight scans, is that the temperature of the skin on my back, if a bear is chasing me, not important at all. So we want to reallocate those resources elsewhere, like large muscle groups, my pupils, my heart to beat faster so I can get all of these resources there. Breathing in deeper. It's that sympathetic side of the nervous system. So when I'm measuring temperature differences, we're basically taking thermometers that are along the paraspinals and rolling them from sacrum all the way to C2, and then measuring C1 right here. That should be relatively equal, and it should be communicating properly. So it will look like if we have full communication, it will look like this pattern where it's like big V-shaped and red, because that's blood flow is warm, right? So let's say when someone first comes in to see me, that is disrupted. We've got blue spots instead of red because there's no communication there. What I will measure along the way is, have we rewired and refired, and we're creating a new pattern. We like to call those repatterns, where it shuts all the way down and then rebuilds back up. Are we eventually getting to that big V-shaped red pattern? Yes, that's how I would measure that. I also measure it like subjectively, because obviously I want to know, hey, is your baby pooping? Cool.
Yeah, I was about to say, do you think I could measure it by a patient going home, giving you a gratitude call saying, hey, I just took a shit, thanks.
Yeah.
Did that happen?
No,
Has that ever happened? Has that happened?
All the time.
Really?
Yeah.
Well, there you go.
We have patients sending us pictures of their baby's poop all the time.
That's glorious.
Yeah.
How often do your clients actually need treatment? How you recommend?
That also depends.
Okay.
I'll give you an example. If we have, you have to treat everybody completely differently. Their nervous system tells a completely different story than anybody else that walks in. We know we can measure different types of impact based upon different research that other neuroscientists have come about. Dr. Heidi Havik is a great example of that. However, some people need more frequency and less adjustments, if that makes sense. Some people need big adjustment with less frequency. Everybody is completely different. I always like to measure that with the scans, measure that subjectively, and also just in general, if we need someone that needs to be adjusted every single day. I will give an example of like a very low functioning autistic kiddo. If their body feels like it is in a fight or flight mode all the time and they can't perceive their environment appropriately, then we need to rewire that. We need their body to feel safe in itself. So then we might see a higher frequency in the beginning. Another example would be someone that has a hot low back. If you can't stand up because your body is like spasming and you have extreme low back pain, we need to get motion into those joint spaces. So the frequency would be higher then.
What are the risks of a chiropractic care?
So where there's risk, there must be choice. When it comes to risk, a lot of the times we look more at benefits. So the risk of chiropractic care usually is mitigated with a proper clinical experience. We're going to look and say, hey, have you been doing these particular motions that could potentially lead to adverse reactions? Are you currently, like, do you smoke cigarettes, or do you have cardiovascular issues? Did you take the COVID vaccine?
What's that got to do with anything?
A lot.
A vaccine could.
Yeah, the spike protein. There's even more research with this.
See, I think the regular person will not relate like vaccines and a lot of things that you're talking about to the chiropractor. I really don't.
Yeah.
For me, chiropractor means, oh man, I think I hurt my neck, or I'm hiking, I'm gonna go and have her crack my back. That's what regular people think.
Right.
And you're bringing up all this extra shenanigans that I've never thought of in my life. You're blowing my mind. I would never thought like going to the chiropractor because someone's constipated.
Yeah.
That's just crazy.
I know.
All right, sorry, I'm kind of
it's okay.
baffled.
Yeah.
That's crazy.
It's important to mitigate any sort of adverse reactions. So if someone comes into my office, and I've sent several people away and be like, we're not adjusting you today. I need you to go to your PCM, or I need you to go to the emergency room. I'll give you an example of one. I had a mom that came in. She was pregnant with her first baby. She'd seen me for quite a few months, weekly pregnancy adjustments. And she came in and she had a vasovagal response, which is she came in and started like feeling like she was going to pass out. And I took her blood pressure. Her blood pressure was through the roof. And I said, hey, we're not messing around with this right now. I need you to go in. Come to find out, she was preeclamptic. So if I adjusted her, was that going to hurt her? No. However, if somebody is having an adverse reaction and they get adjusted, it's going to come back on me, and I very much take care of my people. I very much am going to mitigate where mitigation is due. In addition to that, it's just really important to note that a lot of the research that's been coming around is quite frankly in a positive light for chiropractic, because chiropractic is very safe. It's very efficient. It's very effective. I always love to quote my malpractice, for instance. My malpractice every single year, and I deal with babies. I deal with infants. My malpractice is maybe $1,500 for the year. That's it. Medical doctors is in the millions of dollars. So you tell me which one's safer.
Yeah.
And my license is through the medical board.
Yeah, I know we talked before we started. I was like, I could never do chiropractic work on a baby because I'm thinking I'd break it. You know what I'm saying? But you're like, no, you just gently touch it here, there, and that's it. I'm like, wow, I would never thought that.
Contact, yeah.
Yeah, and right there, that helps them poo.
Yeah,
that's crazy to me. That's so blown. Well, what can a patient do to support their treatment? Like when you leave, when they go home, do you say, hey, maybe try a better posture or anything? What do you do? What do you tell them?
Yeah. So a lot of the times I start off with saying, please don't add a lot of variables. We want to make sure that how we're adjusting you, the frequency that we're adjusting you is matching what your body and nervous system needs. So that's number one. Number two, I always say drink lots of water, making sure it's not naked water. We want to add electrolytes because we're not just trying to flush stuff out. Number two, eat lots of protein, preferably animal protein. I know that's a hot topic with vegetarians and vegans, but it is true. Bioavailable protein would be superior.
What kind of electrolytes are you talking about?
I quite literally only put sea salt in my water.
Oh, wow. Yeah. Okay.
I like Redmond sea salt. That one's the best.
Okay.
But lime juice, lemon juice, all of that stuff. I would also just to say it.
Warm or cold, the water? You request it being a little bit warm? Because I'm reading now that warm water is better for you.
That's what,
and it helps you poo. It does, from what I'm reading. Okay.
I just would stay away from any products that have dyes and just added. If you can't read the label and pronounce everything,
Okay.
just stay away from it. You really don't need all of this extra
You need like
stuff.
less than 4 ingredients in your shit, basically.
I would just say if you can't pronounce it, don't put it in your body, please.
Okay.
Right?
Yeah.
Just keep it simple. I also like to tell people to keep it moving. So functional movements, right? So yeah, posture. How is our posture? But not just that, like look at a toddler. How do toddlers squat? Squat like a toddler, please. We don't want to further injure ourselves. A lot of times people go home and they just sit. Like, oh my gosh, please stop doing
I
that.
can't squat like a toddler.
You're gonna have to learn.
I have a lot of injuries. I can't do that.
You could.
No way. I have too much pain. It's like I would love to do yoga. I like doing yoga.
Okay.
But I've had surgery on my feet and on my big toes. And so I can't bend my big toe to a certain extent. And I'm just in so much pain, I can't do yoga because I don't want to feel the pain. People say that you can live with the pain.
Instructor too, because if you're moving through pain, that's not the goal.
Because a lot of the positions you bend your foot, and that's part of your toes being bent. A lot of the positions you do that. That's why I'm like, because I like yoga, but it's the pain that really gets to me.
I think that if you find a yoga instructor that understands your health history, then they can give you different ways of doing things.
Okay.
Right. So you don't have to do it exactly like this perfect yoga person that can literally bend and put their head on the floor. I can't do that either.
Who squats like a toddler?
Everybody does.
How often do you squat like a toddler?
Every day.
Get out of here.
Yes.
No way. All right, if you say so. I'm not going to.
Instead of bending over to pick something up, we squat like a toddler and hip hinge.
All right.
Yeah.
If you say. Okay. Any advice for anyone interested in doing your field? What kind of advice could you give someone?
Oh my gosh, it's the most amazing thing. I absolutely love every day of, I can't even call it a job. I love it. Something fun that I also do, and it's one of my passions, is I love birth. I absolutely love birth. I think it is so powerful to witness something like that. So I attend births, and I will adjust a mom and hopefully a baby within that time period too. I go do home visits where I'll, give mom and baby their first adjustment. It's such an honor. So yeah, if you want to be a part of a field that adds as opposed to subtracts, then yeah, chiropractic is your shebang. I love our model because it truly is, look to the spine first for disease. Look to the 33 principles that talks about the true power within your body. That is so much more empowering to me than it is to say, one of the things I love about being a chiropractor too, and just what I do on a daily basis, is that people come to me, and a lot of the times it's the Hail Mary. And you have people, and my origin story is also a Hail Mary. And I look at them and I listen to them. I genuinely listen to every single person that walks into my office because I care. I give a shit. And I'm really good at what I do. So that would be my advice. Definitely shadow offices and really pick up on the vibe. There's never a day in my office that I'm not laughing and smiling and really thoroughly invested in every single person that walks in.
That's great.
Mm-hmm.
Are you ready for the Santos signature question?
Yeah, I've been thinking about it. It's just.
Do you think you've ever witnessed a ghost or any type of paranormal activity?
Sure. I think, maybe. I'm going to say maybe to that. I have friends that have told me all of theirs.
Well, yeah, tell me a story that you've witnessed.
That I've witnessed. I was in the car with my best friends, and we were singing at the top of our lungs a song that was special to her father that had recently passed away. And and it was just like a funny moment because for no reason whatsoever, the music stopped. It was I Will Always Love You, Whitney
By
Houston.
Whitney Houston. Okay, I
Yeah,
got
yeah,
you.
yeah. So like that part where everybody's screaming,
You can sing it right now.
No.
Okay.
No. But that part where everybody just like nobody's on key, we're all terrible, nobody's a Whitney Houston. It just completely stops. So all we hear is our terrible voices, and it was just really funny because there was no explanation for it other than maybe her dad being like, gotcha, you know what I mean? Other than that, I would say like a lot of the experiences that I've felt has been more like God moments. I wouldn't say that I've ever been haunted, praise the Lord, because
Okay.
I don't know what I would do with that.
Let me tell you something right now.
Okay.
AI is being introduced into the Ring software system for the doorbells and everything.
Oh, golly.
So we have an inner camera.
Okay.
And it told us like yesterday that there was one human, which was me on the couch, and 2 dogs.
Mm-hmm.
I only have 1 dog.
Oh, golly.
So that's going to start creeping people out.
Yeah.
Because that's going to start creeping people out. I only got 2 dogs. I only have 1 dog. What other dog are you seeing? Could it be because my wife Ruby has her ashes of her dog? Maybe that's walking around. So maybe it picked up the dog toy.
Yeah.
That looks like a dog.
Yeah.
But that's going to start freaking people out too.
Yeah.
But
oh, you know what? Let me tell you something freaky that. So, just so you know, I don't watch scary movies because I am a very sensitive Susan.
I love them.
I can't do it. Even just the sound of it, like The Mummy scared me.
Lee Cronin's The Mummy was like one of the scariest movies I've seen in a long time.
Thank
That
you.
was awesome. That was awesome.
Yeah, they scare me so much. I literally cannot watch scary movies. I don't watch Stranger Things. Like I don't watch any of that kind of stuff because I'm a wuss.
Okay.
So that being said, I was with my very young daughter, and she was riding her scooter around the neighborhood, and there was a lady that I'd never seen before, and she was walking her dog, and I'm 100% certain that she said to, like, under her breath, something about feeding children to her dog. So I'm pretty sure homegirl was
A demon?
had to be.
Yeah, and that was her hellhound?
I don't know,
Okay.
but I told my husband about it, and immediately he went and got anointing oil and was like, "Oh, okay, let's
sage this
Right.
place." Okay. Do you think you ever seen an alien or a UFO?
No, you know what? I just don't. I think I'm too analytical. I really do. My husband says absolutely. He's watched all of those.
I'm down for
gonna
an
be the most
invasion right
boring
now.
person.
They can abduct me, take me, let's go see what's happening. I'm down for that.
No, I do not want that. Please do not do that. You heard him, not me.
Yeah, go ahead. Okay. So you don't believe in aliens? Or you
It's
don't
not
believe
that
in
I
you just
don't-
haven't seen them?
Look, I keep my head in the sand. I don't watch the news. I don't.
That's probably a good
Yeah,
thing.
I am in my own
Positive
little bubble.
vibes.
When it comes to my bubble, my mom always yells at me for not watching the news, but like I firmly believe that we are not, like, as humans, our souls are not supposed to know all of the evil things that are in this world. That's another reason why I'm just not big on social media. I just Have you ever watched the news and been like, I feel better about myself,
Yeah, exactly.
or I
That's
feel
why
better about the world?
I feel like
never
it's doom. It's like,
Yeah.
what's the point?
And this is gonna sound really wild too, but I'm a huge history nerd. I love history. And recently my husband and I have been talking a lot about theology, and I saw it's kind of like a Nat Geo, but for the Bible, and it was one for like women in the Bible. And we've all heard this story about Adam and Eve, and eating the fruit of the knowledge of good and evil, right? And hear me out. I really, really believe that knowledge of good and evil in modern day times is social media. Like I really do.
Yeah, it is. Yeah, definitely. I agree.
Like none of us can confidently say that we feel like we've accomplished anything, or that we it's like we make excuses for how much we're on our phones, etc. And we consume it.
And not only that, you can consume it, But then, do you actually know if that's true? Are they telling you the truth, or is it a lie?
Yeah, exactly.
Because you can't prove it. You just see it. But now AI is so real. It's like more than half the things you see is AI.
Yeah.
Like right now, me personally, I don't think we went around the moon and came back. I don't believe that. Those astronauts, I don't believe any of that now. I don't believe it. I don't believe it. But okay, we're going down to the end of the podcast. Please tell everyone all your contact information, how to get in contact with you.
Yeah. Okay, so we are Hope Chiropractic, and we are located right next to Whole Foods in the Damalas Center building at 1776 Laskin Road, Suite 203. Our social media account is Hope Chiro VB. You can check us out at www.hopechirovb.com. And our phone number is 757-354-1577. I think I covered all of it, right?
Yeah. That being said, please follow me on YouTube, Instagram, and Spotify, Amazon Music, Apple Podcasts. I'm on all that stuff. And basically, if you're having a hard time pooping, give her a shot.
Yeah.
She'll fix you.